Call the roll.
Glenn Whitley, County Judge.
Here.
Roy Charles Brooks, Commissioner Precinct 1.
Present.
Andy H. Wynn, Commissioner Precinct 2.
Here.
Gary Fickus, Commissioner Precinct 3.
Here.
J.D. Johnson, Commissioner Precinct 4.
Here.
Constitutes a quorum.
I waited till you left to go ahead and get started. I just wanted to see if you can run a little bit. Thank you. Our invocation today will be delivered by Robert Bostic from the Alpha Omega Hospice, Fort Worth. After the invocation, please remain standing for our pledges. Thank you for coming out today.
Let's bow, please. Father, I pray that today that you bless these that make up this court, that you bless their families and bless all of us as citizens, and that, Father, you be with them as they make decisions that indeed involve us all. In the name of your Son, amen.
Amen.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Honor the Texas flag. I pledge allegiance to thee, Texas, one state, under God, one and indivisible.
Thank you. Agenda announcements, Mr. Maynes?
Your Honor, we do not have any announcements as relates to the agenda at this time.
Thank you. Court members, you have before you the minutes of our special call meeting of January the 17th and our regular meeting of January the 21st.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously. We have a couple of resolutions and proclamations today. Commissioner Wynn, I believe you have the first one.
Your Honor, we have a ratification of the Lunar New Year resolution congratulating the Asian American communities on the new the Year of the Horse. And I'm asking for the ratification of the resolution to be presented on February the 8th.
Second.
We have a motion and a second. Any discussion? Please vote. Motion passes unanimously.
I was going to have a presentation with lion dance, firecrackers, and so forth. Yeah. But the fire department won't allow that, so we'll do that next year.
Why are you going to have a lion dance if it's the Year of the Horse?
Well, the lion dance is a traditional dance for every year. But if you want to, you can also include a horse. Huh? We can do that next year. If the court
We'd have to go out in the
desires,
unincorporated area. We'd have to.
we can skip the firecrackers. We can do the electronic firecrackers.
We can suspend all rules.
There you go.
Next, we have a proclamation. Commissioner Johnson, I believe you have a proclamation today. Whereas Louis Braille invented the Braille alphabet for the blind and visually impaired, thereby allowing them to be able to read, and whereas millions of blind and visually impaired persons throughout the world have benefited from the use of this alternative way to read, and whereas the American Council of the Blind is organizing and sponsoring Braille Awareness Day events throughout Texas during the months of January and February to commemorate the celebration of Louis Braille's birth, and whereas the local event will be hosted by the Greater Fort Worth Council, spotlighting visually impaired students from the Greater Fort Worth area reading Braille books to both sighted and other children during the story reading time at a local bookstore, and whereas this event will demonstrate that through the development of the Braille alphabet, visually impaired children can read as well as sighted ones, and whereas the promotion of literacy in the world will result in the development of a more productive society, now therefore be it resolved that we, the Commissioners Court of Tarrant County, do hereby proclaim February 8, 2014 as Braille Awareness Day in Tarrant County to honor Louis Braille and recognize his contribution to the blind and visually impaired of the world. In witness whereof, we've heretofore set our hands and cause the seal of Tarrant County to be affixed this 28th day of January, 2014.
Second.
We have a motion and a second. Please vote. Motion passes unanimously.
And I think we have Judy Sprout, President of the American Council for the Blind, she treasurer, and Gene Russell, program chairman. If y'all would meet me at the podium, please. We met downstairs this morning at the elevator, and I think she did better with her stick than I did without one. Congratulations.
Thank you.
Thank y'all very much. If you'll turn around, we'll get a picture. And any comments that you'd like to make, please feel free to do so.
My name is Ginger Kraft, and on behalf of the blind community in Tarrant County, I want to collectively thank the Commissioners Court and individually Commissioner J.D. Johnson and Steve Townsend for their continued support of all of our projects and events. Specifically, we have every year the White Cane Day Walk, which promotes pedestrian safety, and we're currently going to have the Braille Awareness Day, which promotes literacy. Both of these projects are very instrumental in helping promote and foster independent living for the blind. There's some things that the blind cannot do, but there's a lot that we can do. And I just want to accept this proclamation on behalf of the blind community, and thank you very much.
Thank both of y'all for being out here today.
We also have a couple of ladies from the Division for Blind Services that are here today to help support us. And excuse my voice, I'm losing it. Thank you.
Thank you all very much.
Your Honor,
Yes,
could I be recognized?
you bet. Yes, sir.
It was my honor on Saturday to represent the Commissioner's Court in receiving this award from AIA Fort Worth, which is a chapter of the American Institute of Architects. It's a merit award in recognition of outstanding architectural design and achievement for the restoration of the Tarrant County Courthouse Clock Tower. The award was presented jointly to Arthur Wyman Architects. They were the firm, and we were the client, Tarrant County government. So, Judge, if I may present this to you for the court.
You bet. Right. And hopefully, as we continue to restore the rest of that courthouse, we'll be looking at that and considering that. Everybody keeps talking about the, the cistern that we've put in, and
Well,
I understand it's nearly full.
I told them we'd be back next year for the completion of the entire project, and was told that maybe it'll be the following year.
Is it going to be the following year?
I'll be discussing that with February 11th.
Great. We're glad to hear it. Court members, you have, why don't we go ahead and receive and file the this item, the acceptance of this presentation from AIA.
Second.
We have a motion and a second. Please vote. Motion passes unanimously, and you can figure out how to put that on the agenda when it wasn't there. Court members, you have before you the consent agenda.
Move approval.
Second. We have a motion and a second to approve the consent agenda. Any discussion? Please vote. Motion passes unanimously. Mr. Manius.
Thank you, Your Honor. Members of the Court, we have two additional items. On item number one, we're requesting that the court approve a resolution providing approval for the issuance of Series 2014 hospital revenue bonds in one or more series by the Tarrant County Cultural Education Facilities Finance Corp. For Cook Children's Medical Center. You're in an amount not to exceed $180 million. As you see in your court communication, it lists the uses of those. We have received a letter as it relates to our underutilized businesses, also a statement that the property that they're going to be utilizing the funds on do not have any restrictions for governmental activities.
Move approval.
Second.
We have a motion, a second. Any discussion? Please vote. Motion passes unanimously.
Members of the court, on item number 2, we're requesting that the court approve the candidacy of Judge Whitley to the Board of Directors of the Public Power Pool.
Move for approval.
Second.
We have a motion, a second. Any discussion? Please vote. Motion passes unanimously.
Thank you, Your Honor.
Thank you. Ms. Tidwell?
Good morning. We have one item for the,
morning.
I guess I should get here first, sorry. We have one item for the court's consideration this morning, and that is to receive and file the Tarrant County financial statements for the 2-month ended November 30th, 2013.
Move to receive and file.
Second.
We have a motion, a second, to receive and file the November financials. Any discussion? Please vote. Motion passes unanimously. Ms. Glenn?
Good morning.
Good morning.
We only have 2 items for the court this morning. The first item, we're asking the court to receive and file the personnel agenda.
So moved.
Second.
We have a motion, a second, to receive and file personnel agenda. Any discussion? Please vote. Motion passes unanimously.
Our second item, we're asking the court to approve the letter of agreement with Hay Group, Inc. This letter of agreement will allow Hay to conduct the annual market study. Funds are available in the HR budget for this fund, or for this project, rather, and the cost should not exceed $55,000.
Move approval.
Second.
We have a motion, a second. Any discussion? One question. We always get to the budget. Sheriff's Association has concerns. Have we talked with them at all about what we're doing, and or has that committee met to make any requests of Hay that they might want to?
That has not happened yet. That will happen. There is some language in the agreement that points out that there is funding that is available in the budget for those meetings to occur. So that is part of the plan, yes.
And are there specific areas that they're being asked to address this year? Or is it just an overall?
Overall, as typically is the case, I have been asked by the county administrator to have Hay look at IT salaries. Apparently, we're having a little bit of concern, I think, in that area.
I was going to mention that.
Yeah.
Okay. Any other questions at this point in time? Please vote. Motion passes unanimously. Thank you.
Thank you.
Okay, next, Commissioner Brooks, I believe you have an interlocal agreement.
I do. I would move approval of item 8N, 1A and B.
Second.
Our motion is second. Any discussion? Please vote. Motion passes unanimously. Commissioner Wynn.
I move for the approval of the interlocal agreement with the City of Arlington as described in item 8N, 2A and B.
Second.
Our motion is second. Any discussion? Please vote. Motion passes unanimously. Are there any appointments today?
I have a reappointment to the Northern Trinity Groundwater Conservation District Board, Mr. Randall Cozart, who was first appointed in February of 2010 and whose term expired December 31st, 2013.
Want to put all these in one motion? Don't we have some more?
I believe we do, with the only exception that I'm not going to reappoint Russell Laughlin yet.
No, I meant, don't we have some more appointments that we want to make?
Okay, so you're not talking about this board, or are you?
Talking
Okay,
about
I'm
all
sorry.
our appointments.
Okay, then we've got this one for the Northern Trinity River deal. I would like to, do you have any appointments that you, at this time?
No, sir.
I've got one, Deborah Carl, for the historical. Commission, and then also Patrick Mahoney to replace Cleaver Miller on the Sheriff's Civil Service, and I've passed out resumes on both of those.
I have none.
So I will second the motion for those three.
Okay. Please vote. Motion passes unanimously. Did y'all get all those from that standpoint? Okay. Then next we have the claims, including the addendum.
Move approval of the claims, including the addendum.
Second.
A motion, a second, to approve the claims, including the addendum. Any discussion? Please vote. Motion passes unanimously. Briefing items, Mr. Manius.
Thank you, Your Honor. We have 4 items to bring to the court this morning. The first one is an update on the TexRail project. Mr. Scott Mahaffey, who is the chair of the T-Board, is here to address the court at this time.
Good morning.
Good morning.
Good morning.
Thank you for allowing me to come today. It's been a busy year at the T. As most of you know, it just turned 30 years old, and we're very proud of that. And secondly, we'd like to thank you for your continued support and patience with us. I know you have $20 million waiting for us. We're anxious to spend it, and we're moving toward that quite quickly. But it has been an interesting year at the T. As most of you know, the entire board was changed out less than a year ago, and it has been a very steep learning curve. First day on the job, we were given about 6 pages of acronyms that we still are trying to learn what they all are, but we have learned what the FTA is. Part of having a new board is there is no history. No history is somewhat a problem because you don't have things to look back to, but there's also no baggage. And we have looked very hard at alternative ways to do things. Just because it's been done that way in the past doesn't mean it has to continue. One of the things that we're really looking strongly at is the regional concept of transportation in Tarrant County. I know Judge Whitley and Commissioner Fickus sit on the RTC where I also sit, and we see constantly how many people are moving into the western half of the Metroplex. If we don't do something soon, we're going to have a situation that is going to be beyond repair because we cannot keep pouring concrete. And the Transportation Authority is a multimodal, and we have needs for all of our citizens in all different ways to move people from jobs. There are big needs besides TexRail, but today I'm here to talk about TexRail. We can no longer view transportation at a local level because we're no longer a local level organization or community. We're a regional community. Our actions have impact on everybody else's in the whole North Texas area. Denton, Dallas, we're working closely with them to get to a place where we can start working on things together. But one of the things we're looking at very strongly, for your information, is public-private partnerships. That's where we go out and use TOD, transit-oriented development, for ways to attract more economic development around stations, more economic opportunities for organizations to come in and participate with us, creating a better economic environment for our entire community. As we, wrong way, I'm not checked out on the equipment. As most of you know, we made a decision last summer to change the scope of TexRail from going completely to the southwest part of Fort Worth to the airport. And that was made for a couple key reasons. We don't view TexRail as a one-shot opportunity to build a train out to the airport. It's the first phase of a multi-phase project that's going to consist of multiple transportation methods within Tarrant County and the city of Fort Worth. The modification of the MOS also did another thing for us. It allows us to go back to FTA and not cross the $1 billion threshold, which is a key number for them. Our project is going to be 27 miles, $800 million, and carrying around 15,000 riders per day. And what this will do is give people a way to get out to all the jobs in the DFW airport area and, again, provide connectivity through the DART system into the Dallas area. We think it is a huge, huge opportunity for the whole region. This is a list of a few things that have happened on a very 30,000-foot level this last year. Under each one of those, there's several hundred other individual items that have gone up to comprise that. We've completed the EA on TexRail. We redefined the project as requires FTA approval and notification, and we've submitted our New Starts program. Where do we stand in the development process? As I said, it has been a big learning curve, and I know Judge Whitley has seen a chart that we have developed that's about 6 feet long and about 3 feet wide of all the moving parts. What we're learning as we go through this whole complex ordeal is that there are very few things that the T absolutely has control over. We are subjected to many of the issues that I'm sure affect your court. For example, we had multiple delays this year because of the government shutdown. We have our legal EA that's been sitting in Washington since September and has still not been worked on. When you look at this spreadsheet, there's multiple things that we're dependent upon other organizations and completing tasks so we can move to our next step. Right now, we're at the process of anticipating our ROD, finishing up our environmental, and we anticipate to have our ROD in the second quarter of this year. Once we get the ROD, that is a key designation for us. We move from being a project in planning to a real project that's accredited to the FTA. Once we have the FTA ROD, Record of Decision, we then have the ability to go in and ask for a letter of no prejudice, which means we can start acquiring property, we can start letting contracts for our equipment, we can acquire real estate, and we can start doing long-term projects like building bridges over roads where we will come back and ask you for your money that you've so graciously given to us. But it is not the end all. There are many things that have to still go on. We're looking at engineering, and then we'll get to the final New Starts grant, we hope, in 2016. We did have some really good news the last couple of weeks. As most of you know, sequestration has taken a heavy toll on all federal projects, to the tune that when I met with Mayor Price in Washington this spring, Peter Rogoff, who was at that time head of the FTA, informed us that they may not be able to fund the projects on schedule because he had many projects that he had to allocate dollars to continue those projects into the future. Well, recently we've learned that they have approved enough money that those projects will be done in total. We are planning on getting our New Starts money in 2016. We're hoping that we can push it back. The more we can push it back is the sooner we can get the operations up and running. So it's been an interesting time in the transportation world. As I said, the FTA is reviewing our second environmentals. We're waiting for comments back on those. We're working quite closely with the regional director of the FTA here to try to expedite anything we can possibly do. Recently, we have brought on staff a retired person from our district that is quite intimately knowledgeable of the FTA process, and hopefully we'll find some shortcuts that will expect this. And we're looking for our new project rating in February, which is critical. We're expecting a good one. We are at this time finalizing our environmental. We're getting ready to let the contract out within the next 4 to 6 months on the vehicles, which is a key process for us. We cannot do that until we have the ROD, but we are waiting for that. We have consultants that are chomping at the bit to get onto the project. We're doing everything that we can, and we're evaluating all financing options at this time. What our schedule is, we're projecting a second quarter Record of Decision. As I said, is a critical date for us. It's the time that we move to that next step in the project. Third quarter of this year, we'll start doing the awards on the design phase of it, and we hope to get the FTA approval for engineering in the third quarter, which means then we can really start the action items, and we believe that once we start seeing things happening and getting some positive press, that we'll get the momentum to it. The citizens of Tarrant County and Fort Worth want this project, and we're going to bring it to them. Gentlemen, I know you all have lots to do, and I'm willing to talk more about this or answer any questions you might have if you have any. But TexRail is alive. TexRail is moving. One thing I will tell you is we're moving very quickly to bring in a new CEO for the Transportation Authority. I have met with several candidates. We started with around 40. We've cut it down to 5, and we're in the final leg of that race.
Questions?
I have one. The original design for this project had it going down into southwest Tarrant County. That's been eliminated, but, well, perhaps.
Not eliminated.
That's what I was hoping you would say.
It is phased, because what we have to do is look at, this is a multi-phase project, not only for TexRail, but one of the things we're having to do, and we're going to come back to the court and to the city, is as the county develops, we are going to need to have reserved rail corridors, bus corridors, transit corridors, where we, as developers, come in to do things that we reserve property that, for example, the Walsh Ranch area. We're going to have, 18,000 folks moving out there and living in that area. We don't have a way to move them yet. So developers are going to have to be willing to give us corridors.
Even more than that, there were a number of developers who were chomping at the bit to build transit-oriented development projects at projected station locations all along the line. And we would like to see that money spent because it will provide revenue for all of us if those projects are allowed to develop. But it all depends on the TexRail line.
We understand that, and I'll tell you, when I mention public-private partnerships, that's a key element to it, because no developer is going to come in to help us with TexRail unless there's something in it for them, and that's transit-oriented development is one of the key passages that they're wanting to see. And that is one of the things that, as we go forward, we're going to be working extensively to try to develop those relationships. In fact, I've had multiple meetings with several organizations that want to come in and get involved in the project. And we are not excluding anybody at this time, because, quite honestly, the system to finance transportation as it currently exists does not work, because we save all of our money up. We save $400 million up. We go out and get the government to match us, federal government to match us $400 million, and then we build it. Then we're out of money. There's nothing else we can do. That's the same situation DART is in right now. They are not able to do anything for another 22 or 3 years. If you can go in and develop it with a public-private partnership, I'm hoping that we will not be able to have to spend all of our money, that we'll be able to retain a large portion of our money and then leverage it off to other areas and other projects. The Alliance Corridor is a hugely important project, because that is an economic engine for Tarrant County and the city of Fort Worth, that we have to find a way to get people to it, because there are jobs up there. The airport, TexRail will open up 60,000 jobs into the DFW airport. We've got to be able to move people within the Metroplex, and that's why the regional concept is so important, because we'll have the ability to get people from Southwest Fort Worth, Southeast Fort Worth, to the airport, to Dallas, to jobs, whatever. We're talking about ways to get people between Dallas, or between Fort Worth and Denton. We're working with DCTA quite closely on talking about projects that we can do together. But we have to crawl. And as you all are probably aware, Class 1 railroads are not the easiest people to deal with on getting on their tracks. They're here to move freight, and passenger rail is something that is a nuisance to them, but they have been working with us.
Scott, what's the situation on the agreement with DART on usage of the line?
We have, as I promised Mayor Price, I am going to have them all in executable form by March the 1st. We are very close on everything. We have agreed in all principles and all deal points. We're down to a couple small items dealing with UP and TRE line, and a few insurance and some housekeeping items, but we will have it done. In fact, we need that done as quick as possible to help us expedite the rod.
I would like to have a meeting with your team I have a lot of questions. I don't know in depth the details of this project, because I'm rather new on the court. Is that possible?
Certainly. All we have to do is you tell us when you have time, or if you could come to the T, we'll be glad to host you there and show you. We have big graphs and charts of all of this, and we'd love the more information we can get out, the better the project. It works for everybody.
Thank you.
Thank you, Scott. Appreciate you being here today.
Thank you for the opportunity, and thank you for supporting TexRail.
Members of the Court, if we can move to item B, this is our wellness program update. Ms. Norris from the Human Resources Department is here to address the Court at this time.
Good morning.
Amber,
Good morning.
showed you how to-
Yeah. Morning, Judge, Commissioners. How are you guys doing today?
Very well.
Good. First, I want to take a second to say a big thank you to my Wellness Committee that we have, and thank you to all of you guys and the directors across the various departments for allowing them to have participation through all the departments to be representative for their Wellness Committee. They're very helpful in helping us move this program forward. I told them I wouldn't make them stand this morning, so. Okay, a quick overview. Basically, we're just going to take a quick look at the aggregate results from the HRAs from this past July. The overall departmental participation from the health risk assessments, and then the WOW reward, which is the program side of it in which they can get monetary, and the FitPick vending for Tarrant County, and I'll go over that in a little more detail also. Okay, the data. We had a total of 1,502 participants, and you can see the breakdown between the males and females. The 1147 are the folks that actually completed the questionnaire portion of the health risk assessments. It was a pretty lengthy questionnaire dealing on what they deemed, asking questions about their personal view on their lifestyle, what they deemed any type of illnesses, and how their lifestyle is lived, basically. The average age of our participants was 45.6, which is a pretty good snapshot of our community. Now, this number right here, these top 10 medical conditions, this is based on the 1147 that actually completed the full questionnaire. As you can kind of see, it's not really our true picture of how our community looks. As some of our top issues that we have are pretty low on there. This is self-reporting, so you have to look at that picture also. I thought it was kind of funny. The allergies and hypertension, were pretty there at the top, which hypertension is a huge issue, but that, things that we know we deal with, the diabetes and things of that nature, are pretty low on the list. The top 10 controllable risk factors, again, this came based off the questionnaire and how folks answered their questions. Most 62% of our population feel that they're overweight. And then at the very bottom, 8% feel that they have poor fair rating of health. So again, you're looking at still a small snapshot of the employees that we have, but it still gives you a good snapshot of what our entire workforce does look like. Readiness for change, I thought this was quite interesting. So we had 73% say they would like to make some change and reduction in their weight. Dietary improvements are right up there at 72%. Increased activity or exercise at 51%. Stop smoking and stop drinking were 2%. So no one wants to stop those two things, but
We want all that other stuff, but we don't want to get healthy about this.
right. Which I thought was very interesting, and par for the course. So, now this portion, the wellness analysis piece, out of the little bit of data together, so you can kind of see what we are looking like. This is a comparison of 2012 and 13. There are 836 of the total 1,500 basically took him 2 years consecutively. So this data is coming from the 836 people. Basically, our HDL levels, which are good, cholesterol decreased by 1%. Our ideal cholesterol ratios decreased 6% in the male population and 3% in the female population. Okay. Our glucose levels, which is our sugar levels, our high risk, anything above 126, increased 1%. Our moderate risk...
So when you say that, that's not good?
No, sir, that's not good. Our moderate risk went up 6%, and our ideal, which is a good one, went down 5%. Our BMI...
So it's still not good because it went down?
Yes, sir. You would want to see that number go up. Our BMI levels are healthy, which is 18 to 24.9, maintained it at 23% rate. Our overweight went down 2%, so that is good. Our obese went up 2%.
That ain't.
No. And our morbidly obese maintained at 10%. And again, that is out of the 836, so it's a little over 55% of the ones that took out of the 1,500. A small population, but again, it is a clear snapshot of what our workforce does look like overall. And actually, probably a little on the conservative side. Okay, our top 5 departmental participation in the health risk assessments. Purchasing had 76%. I told Jack I was happy he'd come in first at something.
Yeah, somebody from Arkansas, they got to be happy about anything.
Right? I know, that's what I told him.
It's not necessarily been a good year for him.
The DRO at 65, Transportation Services 63, County Auditor 63, and Human Resources at 59. Like we showed up.
Wait.
Yes, sir.
Human resources?
We were saying we're glad we made it.
And that's just in getting the health risk assessments.
Yes, sir. Mhm. That's just out of the department percentage base of how many employees were there and then who actually participated. The WOW Reward, we had 440 employees that actually received a monetary award. And you can see the breakdown across the categories. This year was the first year for a cash option. We did have it was right under 40% chose to take the cash option this year.
And the alternative was to put it in the flex plan?
Yes, sir. So for a first year, that was a high percentage, being our first year to actually offer that option. So as you can see, it comes out to $111,770, basically. So, okay. Any questions on any of the data before I move on? Okay. The FitPick vending. Okay. What is a FitPick? Okay. Well, just a little while ago, we passed a resolution that we brought forth through. We're involved on the Obesity Prevention Council. Commissioner Brooks part of.
Whose logo ought to be on the
I know, right? It should, shouldn't it?
Yes, it should.
Yes, it should. That's the Obesity Prevention Policy Council logo, since we brought that through them. We basically decided through that resolution that anywhere from around 20 to 30%, we were trying to put healthy options in your vending machines, and also to, in your meetings that you would offer, try to promote healthy options in those meetings also. So in doing that, so that we can do that, what we're doing is we are looking at it, our initiative. We've sat down and talked with our vendor, and we're going to push out 20% fit picks starting on March 1st, okay, of 2014, and that is to push out to the entire county. Now, what is a fit pick? That does not mean that it's completely healthy. What it means is it is a better option than what's on the other side of the vending machine, okay? So I've got some little baskets for you guys so you can kind of see our options. So, yeah, so you've got to eat them, okay?
Chocolate chip cookies?
No, sir. No chocolate chip.
Fritos?
No, sir. Although there is a Fiber One chocolate bar in there that it's fabulous. It's like a candy bar.
Things like that.
So basically what the FitPick, so what will happen is you will see this FitPick sticker will go in all the vending.
You've lost control
I
when
know.
you started passing out goodies.
Yeah. Food always gets people's attention, right?
Some of this stuff does look halfway decent.
Mr. Wright, would you like some?
Newton?
Right. None of that.
Enchilada?
Not bad.
Animal crackers.
Yeah. Okay, so you can look at those and see that basically what that is that is a plethora of things that could come out of the 35% market. So what we're doing is we're kind of getting them out, testing it across some of our departments, letting them try them out, see if there's something they like more than another, especially for certain buildings and things that we have, because our populations are different in different areas that we serve vending.
Healthy, he wouldn't be eating any of that.
He wouldn't eat it.
Is that too healthy for you? None
No,
of that?
we're talking about Wilder.
Oh, okay.
Wilder.
No.
He
none of
wouldn't
that.
eat any of it.
No.
It's on your desk, right? Yeah, and what good does that do you? Oh, I thought you were describing yourself.
Okay, we'll move on. So what will happen is as we push this out, basically on the right-hand side of all the vending machines that we have, the Fit Pick sticker will be itemized to show you that it's a Fit Pick. Well, for the public and things that may not know what a Fit Pick is, there's a band, the sticker that will go on the bottom of the vending machine and one at the top that will describe what is a Fit Pick. It's telling you it's a healthier, a better option than the Snickers bar or the chocolate chip cookies or the Doritos. So you're getting a better option, basically. Not always the healthiest, but it is a better option. So that's where we're moving towards. Again, this will start being pushed out with our vendors starting March 1st to the county. So, again, try those out. If you have something that you think would really work, let us know. Again, we're kind of we know that we're going to have to change what's going to go in certain vending according to the area it's in.
Is your goal to move the percentage up gradually over the next couple of years?
We hope so, yes, sir. That's our goal. I told them I didn't think we should pull it all and just stick apples in everywhere, but, you know, I would do that, but I didn't think that was a good option right now.
You might want to hunker
Some
down.
of,
Right?
Some of us thought that was a good
Right, some of us did, yeah. So, yes, sir, that's where we're going to keep kind of moving up, and as we move along and see what sells the best and does the best in the area, we're also moving forward with some education putting up so that people can understand simple, bright, colorful things they can read and look and understand what kind of choices they're making that are very simple. Okay.
Any questions? Or
And
did
then
you have, okay, go ahead.
No, and then the addendum portion is just the rest of the breakdown of the departments according to their percentage of who participated in these. Okay. And that is it.
Thank you. One comment I would make, we had our first meeting of kind of our effort toward looking at the wellness program a week or so ago. I know everybody was represented there. We had several of our elected officials. We're attempting, PEBC is going to be looking at this very strenuously this year, and hopefully we'll come out with something that we'll be ready to begin implementing next year in 2015. It may be so simple as the first year to be that you get a health risk assessment or that you get a physical so that we can establish baselines. As things sit right now, the consultants have told us that if we do not, ours is a self-insured plan, so our premiums and everything we do are based upon what costs and dollars we need in order to be able to cover the costs of the plan. Under the current plan, as it's projected out into 2018, which is when the quote-unquote Cadillac tax begins to apply, if we do nothing between now and then, we're going to be writing a check to Uncle Sam for $5 million in 2018. So in order to basically avoid doing it, I think we have three alternatives. We can do nothing, get there, and write a $5 million check. And that
Is that a one-time?
no, it's an annual check.
It's an annual.
And that one-time check, I mean, we can fund that by either reducing benefits, we can fund it by reducing the budgets in all the other areas, or we can increase taxes. Or we can begin now to attempt to try to bring those costs down, and in effect, the costs are what our health care costs are. And so by trying to implement this wellness program and encouraging everybody in all their departments to begin to be a little aware of it, we've got, for all intents and purposes, 3 years to try to reduce those costs, i.e. make people a little bit healthier, a little bit more aware of what they're doing and what their responsibility is in trying to, one, take care of themselves, which hopefully would bring down the costs. So as, you know, we've talked about issues with regards to wellness in the past. We've talked about trying to offer incentives or, you know, whether it's the carrot or the stick to address the major costs of our health care program, of our employee health care. This is going to be a critical year. I think we're going to be trying to determine how we move forward in our wellness program, what we incentivize people to do, what our targets are, and United Healthcare and PEBC can tell us where our costs are. It's then going to be a matter of how we try to encourage our employees to begin trying to make themselves healthier. It's in our strategic plan, but it's going to be a very deliberate effort, and if we don't start on it as we move into our next year and phase that in, there's no way we're going to begin to see any results, I don't think, until we're 1 or 2 years down the line. But 2018 is not moving. And so as a court, and as we come to decisions about wellness, they're going to be tough decisions. And if we don't make them now, then we just need to understand that there's a $5 million price tag that's coming in 2018 that we're going to have to address in the 3 ways. I think it's coming out of somebody's budget. It's going to be costs that we have to reduce our benefits or increase our premiums to our employees, or we're going to write a check and for $5 million, and if we don't take it out of budget and we don't do that, then we're going to be increasing taxes. And that's a little less than a half a cent. And I don't think any of us are anxious to do that and to know we're going to have to do it on an annual go-forward basis. So as we have each one of our meetings, whether it be at PEBC, whether it be here, we will bring back reports to this group to talk about where we're heading, and at whatever point in time, I mean, that's why it's going to be critical that if you've got concerns, if you're really not, you know, if your thought is, I really don't want to do any of that, then, you know, there's going to be a lot of effort put forward in this, and we need to kind of, as a court, begin to decide what are we going to do. And if the decision is not to do anything but write the check in 2018, that's okay. But if it's to move forward, then it's going to take some tough decisions, and it's going to be something that's not going to be, you know, we're going to be asking all the elected officials and all the department heads, get your people's health risk assessments done. And I think one of the things we may determine this year is that we're going to encourage everybody to either get the annual physical or the health risk assessment so that we can establish a baseline on those areas that we feel like we need to attack. It may be blood pressure, it may be cholesterol, it may be diabetes, it may be obesity, it may be whatever United Healthcare says. These are things that we can help you measure, that we can stay within the bounds of HIPAA, and that we can tell you at the end of the year, these people met their goals. We won't know if they didn't, what they, you know, where they didn't meet them, and we won't know anything about any of those items that we mentioned, but we'll get a list that says these people met their goals and they get the incentives, these didn't and they don't. Or if we decide to go the other way, these people didn't meet their goals, their premiums are going to be higher, those who did are going to be lower. So think about all of that as we go forward. When we have the meetings, we're going to encourage all the elected officials to be present and all the department heads to be present, because in order for this to succeed, the elected officials and the department heads, I mean, we all need to be targeting 100% on the health risk assessments. And we may only begin with the employees, but somewhere in the next year or so, we're probably going to also be including the dependents, because about half of our population for our health plan are the dependents, whether they be the spouse or the children. And we can't address half the problem and leave the other half alone. So I think there's going to be some pretty dramatic decisions to be made this year and next year. And so we don't, you know, in order to be able to really even implement anything next year, we've got to make some pretty hard decisions probably by June, July, so we can begin to communicate it and give people a chance. If for example, if it was just to say you're going to have a health risk assessment or a physical, by the time we get to 2015's enrollment period, in order to get the incentive or in order not to get the penalty, then that means we've got to have that done probably, and I'm looking at HR, but I'm thinking we probably have to have that done by probably the 1st of September. The latest would be the end of September, because as you enroll in November and they're looking like, no, that's too late already,
It is too late.
then what we're saying is they're going to have to do this by a certain date in order to be able to get ready, and even if it's just a baseline for 2015. So that just kind of, I hope, explains the urgency of this and says that we're going to be moving pretty quick, but there's going to be some decisions that we're going to have to make pretty quick.
So what's a better target date?
You're going to need it by probably mid-July, even earlier.
Well, I think it depends on where we end up with what our goal is.
If it's just baseline or...
If we're just talking about a requirement of a health risk assessment or an annual physical, we have a little more flexibility in our timeline because we already have in place a contract to do the health risk assessments. Well, those will be offered in late July or early August. Of course, we typically do our kind of campaign about that and get all that documentation printed up probably in May, June. And if we're going to talk about something more advanced than that, then we'd have to have a consideration of who would provide those services and if there would be an RFP process or if those services are going to come through the PEBC.
So I think some critical decisions that we're going to have to make in the next few months are, is it going to be an incentive or is it going to be a cost? How much and what? If it has to be done by the end of August, or if you have to have a physical by the end of, by the end of August, so that we can get a list and from United Healthcare that says these folks don't appear to have met whatever your requirement is. Do we want to give them 30 days? If enrollment is November the 1st, or whenever we decide, if we want to send out a list that says, Judge Whitley, we don't show a record of you having taken the health risk assessment or taken the physical, you've got 30 days in order to get that done, or here's what's going to happen. If we're going to give them any time frame like that, then those are all dates that back everything up.
Well, that's, you raise a good point, Your Honor, because quite frankly, if we do the health risk assessments in late July or August, really what's going to need to be decided, or at least some fairly clear direction, is what are the penalties if you don't, or what's incentives?
What is the incentives if you don't?
If you don't do that, because it's a lot. Well, it's free, quite frankly, and it's done in work time. That the health risk assessment is something that is probably it may be better suited for the employees rather than having to take time off to go down to their doctor to get the physical. So, if you start taking the July date, you need to start using that as an end date and back away from that to probably some type of activity in May, so we can we can give some direction to our employees.
Well, and the first thing the court's going to have to determine is there's going to have to be a recommendation as to what areas are we trying to baseline. So there's the tough decisions are incentive or penalty, and how much on either side of that. What are we trying to target so that we can make sure that the health risk assessment can target those and can give us baselines in those areas, and then making sure that if you get the physical versus the health risk assessment, that you get those same baseline calculations so that information can be evaluated by United Healthcare.
Tina, why don't we do this? Why don't we use when we're going to do the HRAs, and let's do a timeline leading up to that for not only activities that you all need to do, but also for some decision points for the court. That'll at least give you some idea, and if you want to change those, that's fine, but it'll be a starting point.
I think all of the things that have been discussed today will be discussed to some degree when we have our meeting at COG. I believe it's February 7th. Diana's email indicates that the board will be ready to come back to the individual agencies with a recommendation. I believe it's like a March-April timeline. So, of course, we've had some discussions with her. She knows that we're going to move forward no matter what the other PEBC agencies do. And so, again, I think everything that's been discussed today we will address. We'll have a timeline. Clearly, we're aware of what deadlines we're up against. And at the top of our list is making sure that we can communicate with our employees so that they understand what the expectation will be and what the consequences will be. And so we want to give them, enough time to do what they need to do so that there aren't any negative consequences from the employee's perspective.
One of the things that I think we need to convey to PBC very clearly is the timeline that we feel like we have to have in order to be able to accomplish this. Commissioner Wynn and I are both on that evaluation group. There's about
They're
30
not-
folks.
Yeah.
At the same time, I would encourage other commissioners, if you have staff folks who might be interested in attending that PEBC meeting, to do that. I would also say, though, that, Tina, I would like for us to schedule either the Tuesday after the February 7th meeting or the Tuesday after that, but within a week to 2 weeks of any time we have a meeting at PEBC, I would like a presentation to the court so that they can stay up to speed on exactly where we are and ask any questions or express any concerns as we're moving through that, instead of waiting till the end and then trying to catch up and not having had an opportunity to convey any concerns.
And I think that's a good idea, and we'll plan to do that, and that way we'll know if we need to, tweak things, change things, modify if it's acceptable to the court or not. And again, as you pointed out, we won't wait until the end to know that. We can make adjustments as we go forward if we need to. So we're ready to get the ball rolling. Obviously, we have a well-established wellness program. I think all entities of the PEBC recognize that our program is further along than all of the other programs. I think some of the other agencies are very interested in getting their wellness programs up and running, if they're not up and running, and to make some enhancements to some of those programs where they think they want enhancements. So I think it'll be a good process. It'll be a similar process to the one that we used when we came up with the HSA, the rollout of the HSA in 2014. Again, I think what will be different this time, though, is that we will come back or it'll be our plan to come back every couple of weeks to let the court know what's happening, what developments we've seen, and what's being recommended from PEBC. So it'll be a good process.
Questions or concerns at this time?
I would just add one additional thing, that the invitation that was extended to others, I would want to check with Diana, because we may have an issue with just the size of the room. Because I know when the group met before, it was pretty tight.
Well, and I think if that becomes an issue, then I think we need to talk with COG about possibly letting us have the transportation room at the end of the hall.
I was going to say that larger room might be a better option.
Yeah.
But if we do have others who want to participate, if you'll just let Robin or myself know, and then that way we can make sure that we're in a room that will accommodate all who want to attend.
Thank you.
You're welcome.
Members of the court, we can move to item C. This is an update on our TERS, the energy TERS. Just a quick note as Mark comes up. We're not having court next Tuesday, so the next time we meet, we're going to need to take formal action on these documents. So I think we're pretty well where we need to be, but Mr. Mendez wants to go over a couple of things. And if you have any questions, now's the time to ask, because I think we do have the answers to questions.
Good morning. As GK pointed out, we're on a pretty aggressive schedule to get this CTERS put into place and put together the overall application packet for the infrastructure grant from the state, which is going to be due 3 days after we take action. Given the direction of the court last week, we have moved forward with creating only one zone, putting one project in that zone. We got answers back from TxDOT on if any of the work that we had done in Precinct 4 was going to interfere with our ability to create that. The answer is no, as long as we don't submit a request for reimbursement for anything that has already been done, the engineering or moving utilities of that nature. Precinct 4 has assured us that they can delay the project as long as they need to until we get the grant in hand. and we can move forward with that. So with that, with those answers, we have developed the draft court order and the description. It's in your red folder. We have a copy of the draft. This is currently under review by the district attorney's office, and we have submitted the description of the property to our friends at TAD to make sure that that's not going to create a problem in creating that increment account for that district. Additionally, part of the grant application packet is going to be the road condition reports. Transportation staff is going to be working with precinct staff to develop those reports. We have kind of come to a conclusion as to what that report format should look like, and that will be going out to the precincts very shortly, and we'll be working with them to make sure that it conforms with what is required for the grant. Finally, part of the grant application process is a requirement for a prioritized list of projects. We've also heard back from TxDOT that the way they're going to fund these projects is they're just going to take our prioritized list and start at the top and fund 80% of each project as we go down, and until we run out of money that we've been allocated. So based on that knowledge, we have taken the liberty to look at the overall project list, and in your packet you've got two lists here, a big 11 by 17, which is all 39 projects that were submitted by the precincts, and a smaller page which lists the top 12 of those. The reason I focused on the top 12 of those projects is because that represents the first 3 priority projects that were submitted by each precinct, and we feel that we're not likely to probably get funding even in the subsequent rounds under this first grant that will exceed the first 12 projects. The first 12 projects represents about $6.4 million of reimbursable cost. Our grant initial amount is only $2.4 million. So the challenge to us was to try to fund as many projects as we could countywide with this initial amount. And using the priority list submitted to us by the precincts, we've come up with what I think is probably a best-case scenario, in that we think we can fully fund, for that $2.4 million, fully fund 7 projects to the 80% level, and that 8th project, we run out of money about 37% of the way through there. So we get 8 projects funded, 2 projects per precinct out of this first amount. And we know that there's going to be surplus funds statewide. There's going to be additional monies coming to us once they figure out how much that is and how to reallocate that, which will allow us to perhaps get further down our project list. That's pretty much where we are today. I think we're well on track to have this thing ready for court's action on the CTERS on the 11th, and we're going to have the whole packet ready shortly thereafter to submit to TxDOT.
But you are submitting the entire list?
The entire list will be going as our project list, yes, sir.
Any questions at this time? Thank you, Mark.
Yeah.
Well, wait a minute.
On these priority, the top 12 projects, how is it that my priority that we rated number 1 is number 10 on the list?
Not all precincts submitted projects that were of a same dollar value. And if we put all the first priority projects at the top of the list, we would only have enough money to fund 3.5 projects. So focusing on the top 3 priorities, we did a lot of scenarios trying to get each precinct at least 2 projects fully funded. You will notice that your precinct 1 has the 3rd priority project and the 6th priority project. Those 2 projects were a smaller dollar value, and therefore we could accommodate them under that first $2.4 million.
Okay. Got to spread the limited money around.
What's next?
Everybody's okay with that, so we're moving to our next. I understand that. I'm ready. If you're ready, if you've got anything else to say, then.
I don't have anything else to say, but I think describing it as okay with that, it perhaps overstates.
I mean, I would make the assumption, I won't make any assumptions. Next, Mr.
There's a likelihood that the funding will be greater than the 2.4 million, and that will enable us to move on that.
And I don't know if there are alternatives that would allow each one of y'all to decide what your number one projects are. But at the same time, I mean, I understand what you're saying. Your number one project is the last one that's on the list.
Right. Pretty near.
Would you like to move on to public health issues?
Well, don't feel like you're a Lone Ranger on there. Mine's pretty low, too.
Yours is the last one on the list.
If we could now go to item D. This is an update with the Public Health Department. Dr. Jones is here to address the court.
Good morning.
Good morning.
Good morning.
Just give you another quick update on influenza. In the last week of December, influenza-like illness as a percentage of visits to clinics and hospitals in the county hit 10%. In the following week, the first week of January, went down to 9.6, back up to 10% in the second week. Last week, the third week, it went down to 8.8%. Based on that, and then looking at the North Texas trend and the state trend, looks like we've peaked as far as influenza incidents in Texas, in particular Tarrant County, although it's still widespread. And I expect it will remain that way for a few more weeks.
And it's still early.
And it's still early. Now, last year, we peaked at the second week of January, so it's about the second year in a row we've had an early peak. I've seen it peak in November before. That's unusual, and of course the pandemic, it peaked in October. But for seasonal flu, it's usually late January, early February. 2 years in a row we've done early.
Have you seen two peaks?
You know, it kind of plateaued. We went 10%, 9.6 back to 10. It's not very much difference there. So it was like a 2-week peak, which is a little unusual. Usually it goes up and comes right down. It didn't do that this year. It's all been H1N1. We did detect another virus last week in our surveillance system, H3N2, and that's the virus that circulated last year. So that's not unexpected, but it finally popped up. So far, the 3 viruses we've detected have all been in the flu virus, the flu vaccine, and that's good. Adult deaths, as we mentioned before, are not required to be reported, but for the voluntary reporting we have received for adult deaths, we've had 7 in Tarrant County, 1 in December, 6 in January. They've been 1 in their 30s, 2 in their 40s, and then 4 above 70. All but 1 we know had underlying conditions. What is reportable is pediatric influenza, someone who's 17 years or younger. There have been no reported fatalities of influenza at this point in Tarrant County. There have been 9 in the state, 3 in December, 6 in January. So far, and in fact, countrywide, 41 states are reporting flu as widespread. Having said that, the CDC numbers look like they have peaked as well. So we'll probably be looking at influenza through February and not talking about so much of it in March.
We talked a couple of weeks ago about the disparity or the differences in the numbers between Dallas and Tarrant County. The fact that they were still reporting, or they were still encouraging hospitals and physicians to report under the old Texas rules versus the new. And do we, I mean, we talk about the number of deaths that we have here. Do we feel like that would be significantly higher if they were still reporting under the old rules, or?
I believe it'd have to be. I don't see, the virus isn't different than what they're seeing in Dallas or anywhere else in the state. California kept their reporting system up for adults, and I think they went to 95 last week. And they're behind us a little bit in their flu incidents. They're still going up. And so if you look there, they're seeing a hard year compared to last year. So I believe we're probably having the same thing. It's just a difference in systems as far as how the reporting's going. So when you hear about, I think Travis County down Austin had somewhere over 10 as of last week, and yet I know they're calling out and doing specific reporting. Had they been doing the same thing Dallas had been in the last 4 years, I think their numbers would be up. So I can't see why we would be different.
And was there resistance, or would there be resistance to us adopting the other policy of reporting? Or
Well, I've talked to a few of the infection preventionists who are our partners at the hospitals. Many are willing to look at how we can do severity measurements in the new year. We did ask last year about hospitalizations, which is what Dallas does. All hospitalizations get reported. And talking to the Dallas people, that's very burdensome. So maybe something along the idea of mortality. And some of them were willing to do it. One facility said it would be difficult for them. They're a larger facility. We'd have to work through their process to see if we could do it or not. We did start asking for ICU admissions, percentage of ICU admissions that are due to flu. And as of last week, that was 5%. Of course, that's a one-week statistic. We don't know what the trend is. We don't know if that's good or bad. And that's 6 hospitals that were participating last week. I anticipate we'll get 2 more this week.
If we had more robust data, what would we do differently than we're currently doing?
That's a good question. We would still be emphasizing get your flu vaccine. The advantage, I think, of having the death data out there say these folks are suffering, or dying, brings it home to people, you really need to get your flu shot. Unfortunately, it brings home that message a little late. You should be getting it in November, not when people are starting to go to the hospital with it. And so there's not a lot different there. The other information, and the state's already collecting it, is the number of beds that are available, the number of ventilators that are being used in the hospitals, and those have gotten tighter as we've gone through flu season. It does every year. The difference that occurs there is if it gets to be a short supply, then they can step in and rent or get more ventilators brought in from their stockpile. But what the public health message it wouldn't change a lot. Still get your flu vaccine. Just let people know this is what's going on. And it's a situational awareness thing for the other medical providers in the community. Did that answer your question?
It did, but I think it left out perhaps one of the benefits of collecting more robust data, which is to allow hospitals, not public health, but tertiary care institutions, to do a better job of planning for the outbreak, making sure that they have enough ventilators, that they have enough drugs. And,
gives them a heads up.
Gives them heads up. Yeah.
It does. And one of the things, and it would need to be more robust, our ILI surveillance, usually, I think I mentioned last week, when it peaks, hospitalizations will peak 1 to 2 weeks later. And so it's a good predictor of what's happening in the hospitals. But it doesn't tell you how big that peak or how severe it's going to be in the hospitals. So like JPS reported in the 2-3 weeks ago, their hospitalizations are about 2 days longer from flu cases as compared to last year. That's a pretty good, interesting measure. It's a huge amount of resources. And so, yeah, looking at that might be useful. And that's what we hope to do, albeit at the end of the season, to review this with our partners in the hospital to see what we can do. It might be useful.
Any other questions? Thank you very much.
Thank you for your time.
Thank you.
Your Honor, that's all we have at this time.
We'll now recess our open meeting and proceed to close to discuss items exempted under 551.071, 072, 074, 076, 087, and 0725 of the Texas Government Code. Having returned from our closed session and there being no business to conduct at this time, we are adjourned.